Time for tonight's Hot Topic Tuesday, and we're talking about vaccines, especially when it comes to flu and COVID. With COVID, the CDC has changed its stance on who should get the vaccine, as well as some pharmacies who will only give it with a prescription in Pennsylvania. Joining me now is Dr. John Goldman with UPMC, who specializes in infectious diseases. Thank you for being here.
Thank you for having me.
So first of all, for those who are interested in getting the vaccine, what's the latest COVID strains that are out there, and is there anything new in the vaccine being offered?
So the latest strain is something called XBS. And what happens with COVID is that the strains, the variants, shift pretty rapidly. And what really makes them depend on what the predominant variant is how quickly they're able to transmit. Usually now, that means that they get a little bit around pre-existing immunity, either to vaccines or to other strains. The good news is that even though they get around the immunity and you're more likely to be infected, pre-existing immunity, either to the vaccine or to another strain, it makes it very unlikely that you're going to get very sick, hospitalized, or even die. So at the height of COVID, we had 20,000 deaths per week in the United States. We probably have 200 or 300 now. It's many, many fewer. So the pre-existing immunity, even though it may fail, you may get infected, you're not nearly as likely to get sick. Now we are still recommending that you get the COVID vaccine, especially for people who are above the age of 65 or have other medical conditions, because COVID now kind of acts like the flu. It's more mild, we don't have as many people ending up in the hospital, and with the flu, 90% of the people who end up hospitalized or die are above the age of 65. And now with COVID, it's kind of following the same pattern. So we do strongly recommend the COVID vaccine for people who are above the age of 65 or have another medical condition.
Speaking of the flu, how do we know which strains are going around?
So what typically happens is right now in the southern hemisphere, it's winter. Mm-hmm. They have their winter during our fall. They have during our spring and summer. And their flu season during our summer. So we know what the strains are that are circulating in other countries. We know what the strains are circulating in the southern hemisphere, and those typically go into the strains that we put into the flu vaccine each fall.
You said the best time to get that is October. What else can we do to keep ourselves healthy as we start to enter into these next months where viruses are prevalent?
So I do strongly recommend the vaccines. I think those are one of the best ways to keep yourself healthy. Strongly recommend hand washing. The flu and COVID often are spread on surfaces from people sneezing, and if you're washing your hands frequently, you're much less likely to get them. And we strongly recommend that you don't have presenteeism. If you're sick, you shouldn't go to work, you shouldn't go to school. And because if you stay at home, you can infect one or two people in your house. If you go to school, you go to work, you can infect a lot of people. And then it's common sense. If you see someone who looks like they're sick, is sneezing, is coughing, has their nose runny, stay away from them.
Stay away. Great advice on that. Thank you so much for
Thank
joining
you.
us tonight, Doctor.
Hi, I'm Eric Finkenbinder from ABC 27, and we're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home, and it's very easy to use. With a Fire Stick, go to the home page, scroll down to search. From there, enter ABC 27. Move over to the apps, and there we are. Click the icon and install. It's just that easy.